Hi, I'm Madison. I'm in 11th grade at Frontier Regional School, and I'm a CTC youth leader. I will be sharing data about risk and protective factors. This survey asks questions about the underlying causes that might lead to problems like drug and alcohol use, violence, school dropout, teen pregnancy, and so on. Risk factors make those problems more likely, and protective factors make these problems less likely. Some examples of risk and protective factors on the survey are perceived availability of drugs, family attachment, school engagement, and attitudes favorable to antisocial behavior. Each of these examples is related to one of four different domains: community, family, school, and peer and individual. The good news is that there were really encouraging improvements in almost all of the risk and protective factors in the survey this year, especially in the family domain, as well as the ones that are directly related to drug and alcohol use. While almost everything changed for the better, there were a couple of things that got worse: attitudes about antisocial behavior and engagement in school. This slide shows 8 risk factors that are directly related to drug and alcohol use, like laws and norms favorable to substance use, perceived availability of drugs, sibling drug use, and so on. Every single one of these got better in 2025, and almost every single one of these has been getting better pretty consistently since we started this survey in 2003.
Hi, I'm Nate. I go to Greenfield High School and I'll be talking more about family attachment and protective factors. We saw several improvements this year. You can see that all of these family protective factors got better in 2025. In the next slide, you'll take a closer look into the questions that make up the family attachment protective factor. Please note that these questions are traditionally gendered and not inclusive for all families, and we recognize that this is a limited survey. 2 questions that go into family attachment are: do you enjoy spending time with your mom, and do you enjoy spending time with your dad? And it's really encouraging to see these big increases in the percentage of students who really enjoy spending time with their parents. 2 more questions that goes into family attachments are you close with your mom, and are you close with your dad? And again, there have been really nice improvements in these both as well. And the last 2 questions are: can you share your feelings with your mom, or can you share your feelings with your dad? And while these 2 have improved, you can see there are some pretty big differences between moms and dads for each of these questions. This is something we could probably stand to work on as a society in general. But interestingly, we can see that students that can share feelings with their dads, even as a smaller group, have the lowest risk of depression symptoms. And in general, we see that when students have strong attachments to their parents, they're at lower risk of symptoms of depression than their peers who do not.
Hi, I'm Ada and I go to Four Rivers, and I'm going to talk more about risk and protective factors. As mentioned earlier, attitudes about antisocial behavior are one of the few things that got worse this year. This slide shows 2 similar risk factors that have gotten worse since 2018, which is parental attitudes favorable to antisocial behavior and peer and individual attitudes favorable to antisocial behavior. Here are 3 questions that go into the parental attitudes favorable to antisocial behavior risk factor. How wrong would your parents think it is for you to pick a fight with someone, to do graffiti or write things on buildings, or to steal something? And these lines are the percentages of students who say their parents would think it's not wrong at all. So we would want this to be low. These were generally pretty low a decade ago, but we've seen these increase since 2018. Likewise, with students' own attitudes about antisocial behavior, these are the questions. How wrong do you think it is for you to pick a fight with someone, steal something, cut school, attack someone with the intent of seriously hurting them, and taking a handgun to school? And again, these are the percentages of students who say it's not wrong at all, so we would want to see this be low. We reached an all-time low in 2018 after a long, steady decline, but it has turned around considerably since then. But despite troubling news about attitudes getting worse, fewer youth seem to be actually engaging in antisocial behaviors. This is the percentage of students that have reported having ever been suspended, ever been arrested, and ever attacked someone with the intent of hurting them. However, according to our data, those students that do engage in antisocial behaviors seem to be doing so at younger ages. This is the average age that students report first being suspended, arrested, attacking to harm, and we see decreases for all over the last 2 decades. This is not to say that more 11 and 12-year-olds are doing these things than before, but that more support may be needed for younger ages. Another protective factor that's gotten worse while almost everything has gotten better is engagement in school. This graph shows the steady decline that we've seen in the percent of students who are engaged in school from close to 60% to now about 30%. The questions that go into measuring engagement in school are: how often do you enjoy being in school? How often do you hate being in school? How meaningful do you think your schoolwork is? How important the things you're learning are going to be for your later life? How interesting are most of your courses? And how often do you cut or skip school? Our survey doesn't give us direct answers to why. We sometimes can get clues from the data, but we'd be curious to hear from all of you on why you think engagement in school has gotten worse.